to cloud. Okay. Good evening, everyone. My name is Paula Bowens. I am the president of the BAC. So welcome to our event as we recognize August as the National Minority Donor Month Awareness. And we want to welcome our guest, which is United Network for Organ Sharing, UNOS. So thank you for joining us. I'd like to just say thank you to our fellow alum, Wanda Randolph. She's not here with us tonight, but for connecting us with UNOS. She works for the organization and she reached out to us in terms of your initiatives in terms of the recruiting. And she wanted us to be a part of it. And this is how we start our relationship with UNOS. So if everyone is looking to change career or if you're newly grad, please go to the website, unos.org, for any opportunities. And if anyone can put that in the chat, I would greatly appreciate it. The reason I'm excited is I'm a donor as well. So I said yes to the DMV license, and I'm interested in learning. The possibility of making an impact by saving life is significant. And in a few moments, I will introduce Amber, and she will introduce the team. First, housekeeping is that, of course, please make sure you're muted. And we will have time later on for questions and Q's and A's. And it looks like we could actually unmute ourselves and ask questions as well. For the alums, stay tuned for any upcoming events, especially come homecoming. We'll be kicking it off in October. And if you're not connected with the Alumni Association at the time, please make sure you update your information to get the upcoming events as well as BAC. And Amber, I will turn it over to you.
Thank you guys for having me tonight and giving me the platform to share my story. So back in 2012, I was diagnosed with heart failure stemming from a viral pneumonia infection that had attacked my heart muscle. I was 20 years old at the time, preparing to go into the Navy, and felt like I had my whole life ahead of me, as most young 20-year-olds do. At the time, the diagnosis was devastating. I was kind of in denial, thinking it was something that you could kind of quickly get over and move on back to my life. But life clearly had other plans for me. And so I struggled for about 3 years or so, with just having good and bad days, not having a lot of energy, feeling really bad, but continuing to push through. I was pursuing my education in pre-med and also working at a local hospital. And then in April of 2015, my health unfortunately took a turn for the worse. And I was placed into a coma emergently for about 4 weeks and woke up in ICU here in Richmond with what's called an LVAD, or a left ventricular assisted device, which is essentially a heart pump to pump the left side of my heart and to keep me going. And at the time, my doctors felt it was necessary for me to get placed on the heart transplant list, which I am forever grateful for. And that really started my journey, the transplant journey for me. So from there, I continued to wait, learned everything that I could about heart transplantation through my doctors, through online support groups, and was also connected with UNOS through Leisha Schaffner, who unfortunately we lost over the weekend. I waited for about 3 years, and on March 9th of 2018, I'm happy to say that I received the call for my heart. I remember that day very clearly. It was a whirlwind. I couldn't even believe that the call came in. Got to the hospital, and I always like to laugh about this. I delayed my own transplant by about 15 minutes because I showed up in scrubs. I had come just from work. And they thought that I was the nurse waiting for the patient to arrive. And so they told me to put my stuff down in the room. They're like, go ahead, you can put her stuff down. She's on her way. She just called us. She's about 10, 15 minutes out from the hospital. And I was like, wait, no, I'm the patient. I'm the person here for the transplant. So they were, of course, decided to kick it in high gear. And one thing led to another. It was a whirlwind. And the last thing I remember is picking my music for the operating room. And I woke up with a fresh heart and a new lease on life. And so for me, I'm just forever grateful to my donor for this incredible gift, and just forever grateful to family that may have encouraged that person into organ donation. And as a result, I'm here. I've graduated from nursing school, been able to participate in 10Ks, go on vacations with families, go to weddings. I can walk up the stairs again without needing to stop and catch my breath. And now I'm actually working with heart transplant recipients and heart transplant candidates currently in my first RN job. So I'm incredibly grateful to UNOS and all that they stand for, all the work that they're doing. I'm happy to be an ambassador for them, to be able to share my story and share just about the wonderful work that they're doing. And just extremely grateful that they asked me to speak during the National Minority Donor Awareness Month, because this is incredibly important for anyone, but especially for minorities. Get registered, become a donor. It is life-changing for yourself, I'm sure, and incredibly life-changing for those that are receiving the gift of a second chance at life. So thank you guys again. And I pass it on to David Fleming.
Sure. Thank you so much, Amber. What a great story. And I had the honor of being able to attend Lisa's funeral today as we celebrated her life. Just a wonderful light to everyone in Richmond. So anybody on the call that grew up in and around Richmond, you probably saw Lisa Schaffner as a news anchor. And then she left her dream job, as they said today, so she could spend more time with her family and with her kids in particular, and started working with United Network for Organ Sharing. And we were all blessed to have her in our lives for quite a while. And just, I'm a preacher's kid. All my staff know this, Bobby knows this. So I've been to about 300 funerals, and today was probably the best funeral I've ever been to. It was unbelievable. So I'm going to try and summon my inner Lisa Schaffner today. And so thank you so much, Amber. What a great testament to what we want to achieve. The diseases that necessitate someone needing an organ transplant don't see skin color. They don't see cultural relevance, and they attack us all. And it's as a family and as a country together, we can move forward. So thank you so much for your story. And what a fantastic entry to this. So my name is David Fleming. I'm president and CEO of Donate Life America. I've been blessed to be in this position for a little over 21 years now. I like to say my career at Donate Life America can legally drink now, which is relevant since we're talking about JMU. And also excited to say that I have a junior son who just went back to JMU on Friday. So for all you JMU folks, JMU Dukes, right? Everybody's heard that? There we go. I unfortunately had the opportunity to play against JMU. I played football for the College of William and Mary, my alma mater. And back in the old days, we used to do pretty well. The last JMU William and Mary game I went to was 48-0 JMU at halftime. And I think the only first down William and Mary got was a pass interference call. So you guys are kicking the butt out of my old alma mater. It's exciting to see with my son being there. But really love JMU, and so excited to be able to share this information, and hopefully with the video we can get it out to more people. But thank you so much for the opportunity. We can go on to the next slide. So Donate Life America, we sort of call ourselves a sister organization, if you will, to the United Network for Organ Sharing. When I started at Donate Life America back in the early 90s, we were in the UNOS building. We really relied heavily on the infrastructure that UNOS had as a small nonprofit that was getting up and going. We are now wholly independent from UNOS, but Lisa and so many staff people that I saw today, we work hand in hand with UNOS. And UNOS's primary role is in the allocation side. So when someone was an organ donor, made that incredible gift of life, UNOS decided based on their algorithms and who was the best patient for that, based on the waiting list, based on Amber's medical condition, who was the best match for that organ, if you will. On Donate Life America side, we work to encourage Americans to register a legal decision to be an organ and tissue donor, which we'll talk about a little bit later. So we're sort of kind of the yin and yang of donation and transplantation, if you will. And we are very proud to be close partners with the United Network for Organ Sharing, a little bit more public facing than UNOS is at the national level. But so excited to have them as a supporter and partner of what we do. And we love the fact that we have the ability to work collaboratively with another group that's here in little old Richmond, Virginia, sort of the heartbeat, as Amber might say, for donation and transplantation. So we are a national nonprofit. We have state teams in every state. We work with our organ recovery organizations, our tissue banks, eye banks, transplant centers, our DMV partners, and other organizations to increase the number of Americans that are making this legal decision registering to be an organ, eye, and tissue donor. We own and manage the Donate Life brand, which hopefully you see on license plates and bumper stickers and t-shirts around the country as we look to increase the brand footprint for organ, eye, and tissue donation. We're always working to motivate the public to register to make a legal decision to be an organ, eye, and tissue donor that can be acted upon. Of course, we're always looking to educate on living donation. We're currently piloting a new national living donor registry, which is very exciting. It's something we'll talk about a little bit more later. Importantly, we manage our national registry in partnership with Apple and iPhone so that you can register to be an organ, eye, and tissue donor. It's as easy as going to your iPhone and your health app to register that decision. We also work very closely with our DMV partners. As you heard earlier, Paula talking about she had registered to be an organ, eye, and tissue donor via the DMV. Our DMV partners are so important to us. They're really on the front lines of saving people's lives through organ, eye, and tissue donation, as they're offering the opportunity for someone to register to be a donor via a typical driver's license transaction. And then we work to execute multimedia campaigns. We'll show you some examples of that as we seek to sort of cut through the media clutter. You know, when I was a kid growing up, there were only 4 or 5 stations on the television. We all know that in today's world, we can watch 1,000 shows on 1,000 channels at any time, whether it's on your phone or your laptop. You know, we've got Roku, we've got Apple TV. So the idea of getting something that penetrates and really gets people's attention is very difficult in today's media world. So we work very hard with our creative partners, the Martin Agency, which happens to be based here in Richmond, best known for their work, their Geico commercials that everyone has seen, to really figure out how we can effectively cut through the media clutter and provide people with opportunities to register to be organ, eye, and tissue donors. Next slide. So this is, our goal is to increase the number of lives that are saved and healed through organ, eye, and tissue donation every year. This has been a little bit of an umbrella sort of campaign slogan, if you will, for the last several years, which is our goal is to provide hope, healing, and life to as many people as possible, as creatively as necessary. And we're going to show you some examples in the following slides of what we mean by as creatively as necessary, but it all really boils down to how can we bring the story of organ, eye, and tissue donation to you as part of everyday life, whether it's through your church, whether it's through entertainment, whether it's through a sporting event. The opportunity to bring the opportunity to register to be a donor to the consumer is part of everyday life, versus relying on consumers to come to us to register through a DMV transaction. So we want to make sure that we have as many creative touch points, if you will, as we can have with the American public to give them really easy, simple opportunities to register to be a donor. Next slide. So these are a couple of examples here. Some of you have probably seen some of the Saw series, which is a popular sort of macabre series about people getting killed and murdered in all sorts of crazy different ways. We found out that they were going to do a new movie that was originally going to be named The Organ Donor, which we had a little bit of pause about. And thanks to Hillary and the Martin Agency, Hillary is one of our staff people that's on the call that really works on our social media and a lot of our outreach. And I also want to give a shout out to Jocelyn Reed, who's also on our call. Jocelyn's basically the glue that holds our organization together and is a huge champion for our multicultural outreach. But so this is on the left here is Marisol Nichols, sorry to call her Samara, Marisol Nichols, who did a public service announcement as part of the SAW cast to help us increase education around organ, eye, and tissue donation, because there's not really a direct storyline, but they recognized the opportunity to reach out and help us reach people with the message of organ and tissue donation. In the center here, you're going to see this is Freeway, who hails from the Philadelphia area. Freeway is one of the original rappers in our country that just really hit the charts early on. Freeway is a kidney recipient. He also has the honor of being a donor father. And Bobby has done some interviews with Freeway that we have been distributing over the last month. It's really, really powerful storytelling around Freeway, his journey, finding out that he needed a kidney transplant, having no idea that he was at risk, which is one of the important things that we want to bring to our multicultural communities to make sure that find out if you are at risk, particularly for kidney disease. But Freeway has just been an incredible spokesperson. We're so honored to be able to share his story. And then on the right-hand side here is a gentleman named Eric Compton. You can see the Donate Life logo on his sleeve. Eric is a 2-time heart recipient who finished runner-up in the US Open on the PGA Tour. Gosh, probably 5 or 6 years ago now, but what an incredible story that an individual that's received 2 heart transplants is able to compete at the professional level because of the 2 gifts that he received that allow him to be able to compete and to be a professional athlete as a recipient. Just an incredible story. Next slide. So here's Mr. Bobby, who you're going to hear from in a little bit, interviewing Freeway. Just incredible storytelling. I don't like to use the phrase organic very much because I think it's overused, but just really an organic conversation between Bobby and Freeway, and our ability to share that story online, and really hope to reach out to our young people that are attracted to not only in this particular instance, the urban streetwear culture and the ability to tap into sort of the affinity that many of our young people have, particularly our young males in our urban centers, with 83 Futures, which was a partnership between Donate Life America and the MART agency. But a huge thanks to Bobby and his talent and getting some really, really powerful storytelling out of Freeway with his interview that we've been sharing online throughout the month. Next slide. So this is one of my favorites. This is probably the hardest I've ever worked, which was getting approval. And I think Bobby was on the board at the time for us to do a very aggressive campaign reaching out to males between 18 and 35. And this is our campaign about the world's biggest asshole. It featured a fictional character named Coleman Sweeney, who's bottom left here. Coleman, by anyone's standards, was an asshole. And at the end of the video, it's about a 3-minute short film. You find out that Coleman was a registered organ and tissue donor, and after his death was able to save the lives of a kindergarten teacher, a gentleman who received his liver and was able to spend the rest of his life with his family. And the tagline is, even an asshole can save a life. This is about as edgy as we'd ever gone. This campaign took us about 1.5 years to get approval through our board to really get it going. But the wonderful thing about this, we didn't spend a dime to promote this. We reached out to the public. It was all earned media, if you will. And within the first 10 days, we'd had over 100 million views of this video. And fantastically, we saw organ donation rates on our national registry with males 18 to 35 went up over 800%. So it was very effective, but this is an example of what we mean when we say as creatively as necessary. We're willing to get sort of down and dirty and do what needs to be done to reach out to the public and to meet them where they are. We recognize that education on its face value, it's hard to get attention for that. So we want to entertain people while we are educating them. And this is a great example of sort of storytelling that snuck up on people. When we did focus groups on this with college students, they thought it was a trailer for a new HBO show. And they had no idea that at the end, they were going to be encouraged to register to be an organ and tissue donor. It was extremely effective. It's something we hope we can build on in the future. And 83 Futures, ironically enough, that we just talked about with Freeway, is a bit of an outgrowth of this aggressive stance that we're taking to meet consumers where they are as part of everyday life. Next slide. So this is also who we are. I'm not sure what's coming next. Next slide. So our brand, through April, which is National Donate Life Month. We're so excited. We have a photo contest where people are submitting photos like you see here. And when we talk about brand at Donate Life America, it's beyond the logo. The logo is the image that we portray, but really what is behind that is the way people think, act, and feel relative to organ, eye, and tissue donation. We want people to recognize this is an incredible, generous gift. It's a gift that we want to honor at every opportunity. And we're so excited to see examples that you have here in the top left corner. This is a group of medical professionals from Swiss Medical in Washington State summiting a mountain, flying the flag, to people, making baked goods that look like our logo and everything in between. So very excited to have the opportunity and really grateful for the embracing that people have to share like I said, really the brand image, not just the logo, but what does it mean behind it, which is saving and healing lives. Next slide. Some more brand imagery. Very excited here that you can see these are some of our medical teams around the country that are also embracing and sharing the message during National Donate Life Month. So a little bit of donation 101. Organ, eye, and tissue donation starts with this generous gift to be a donor. I've talked about registering to be a donor, and I want to make sure everybody understands this is a legally binding contract, if you will, that you are making, which means even if your family wants to fight this, in the United States, every state has embraced what we call first person consent, which means this is your decision to be an organ, eye, and tissue donor. We understand that on occasion families may disagree with this, but we want to honor the individual's decision to be a donor. Why is this important? It's important because, as I said earlier, my father was a pastor, and my father always said that grief isn't the only emotion, it's just the most powerful one. And when you have a loved one that dies unexpectedly, like we just had with our good friend Lisa Schaffner, you don't want to leave it to your family in that moment of grief to make the decision. It's your decision. And we want to encourage people to think about giving this opportunity to give life to someone. And we want to honor that decision by making sure we're going to act on it, even in the generally rare instance that your family may be confused about it. But we understand that grief is a very confusing time. And really what we have found through real world experience, I know Bobby can speak to this, families, it's a gift for them to know what you wanted when you die, and to not leave that decision to them. It truly is a gift to make that decision and make this legally binding decision early on. Next slide. So unfortunately, we're in a situation, we have over 100,000 patients that are currently waiting for a life-saving transplant. In a world of big numbers, it's hard to think about what 100,000 people looks like. I think the JMU stadium probably holds 25,000 people on a packed day. I know Ohio State University holds about 110,000 people. So you think about a Saturday football game at Ohio State, you get 100,000 people. That's what 100,000 people looks like. It's a big number. On average, we have about 20 people that are dying every day because they don't get a transplant in time. And unfortunately, because demand really continues to outstrip the availability of organs, we have about 9 people. Someone is added to the waiting list every 9 minutes in the United States. And our organ recovery organization, our transplant centers are doing everything they can to help people. We're just in the situation now where demand continues to outstrip the supply of organs that we have, which is why registering to be a donor is so important. Next slide. So the process, when someone like Amber needs a transplant, they consult with their physicians. They're listed through the United Network for Organ Sharing. But importantly here, it's really that decision to be an organ, eye, and tissue donor when someone dies in a medically suitable way that allows them to be an organ, eye, and tissue donor, which is about 1 in 10 on the aggressive side. Then that organ is recovered by an organ recovery organization. And then UNOS, based on medical criteria, I really want to focus on that. Individuals are blind to the system. It's really all based on your medical criteria as to who is the next candidate that the system believes is going to get, is going to be able to get the most out of that transplant. Next slide. So we work with a lot of organizations. I talked about Apple and iPhone. Walgreens is another example of a corporate partnership that we are looking to reach out to and allow people to register to be an organ, eye, and tissue donor through like the Walgreens app. Just got some timely data today. We found out that since January, over 38 million people at Walgreens have received information about how to register to be an organ, eye, and tissue donor when they've been getting their prescriptions filled. And so just really excited about our partnership with Walgreens. And of course, we're always looking to expand our corporate partnerships. Corporations do a great job of getting in front of Americans. And we want to partner with organizations like Walgreens to help provide these opportunities for people to register to be an organ, eye, and tissue donor. Next slide. So when the rubber really meets the road, does registration work? Does it matter? So for the last year, 55% of all of our organ donors have been authorized, which means consent to be a donor has happened because they were already registered to be an organ, eye, and tissue donor. 57% of our tissue donors were authorized by a prior registration, and 64% of our cornea donors were authorized by a prior registry. We currently have over 165 million Americans are registered as organ, eye, and tissue donors. Before this call, I looked up how many adults we have in our country, which is 209 million, which means we have about 78% of adults, people over the age of 18, have made this generous decision to be an organ, eye, and tissue donor and to provide this opportunity for life and a second chance at life for our patients that are waiting. So we like to think about it that we have 165 million people that have joined our group. So we are the largest membership organization in the world, other than the IRS, which we think ours is more fun than the IRS. Next slide. Does registering to be an organ, eye, and tissue donor change my patient care? This is one of the biggest myths that we fight. There's always that myth out there that if I'm a registered organ donor, I'm worth more to people in parts than I am as a whole person. It could not be more false. And something we really want to focus on this call is to make sure that people know that if you're a registered organ, eye, and tissue donor, you're going to get the same care as someone who is not registered. You just have the opportunity to give someone the gift of life. If all of the things that are done to try and save your life fail, but at the end of the day, you know, the care level is exactly the same as if you're a registered organ donor, as if you're not. Next slide. Does my religion support organ, eye, and tissue donation? Every major religion in the United States supports organ, eye, and tissue donation. We often hear sort of fringe commentary from people that are Jewish or Catholic that think that their religion does not support organ, eye, and tissue donation, and the Muslim community as well. But actually, in most religions, it's really considered sort of a higher calling. The Jewish faith would call it a mitzvah if you're a registered organ, eye, and tissue donor, which sort of elevates this gift as something to be celebrated in the afterlife. And we want to make sure that everyone knows that all major religions support organ, eye, and tissue donation and encourage people to register to be donors. Next slide. So social or financial status, as I said before, really to UNOS and the system, you're a number. They try and strip out and make sure that social status, financial status has absolutely nothing to bear on your ability to get a transplant. It is based on medical need and medical urgency. It's based on how sick you are. And another stereotype that we really want to try and fight is to make sure that people understand that celebrity status, though we hear about celebrities that get transplants because we want to take advantage of that opportunity to normalize it, there is no advantage regardless of your social status, celebrity status, or financial status. Next slide. So at Donate Life America, we're really getting involved in living donation. We're currently piloting a national living donor registry. So when someone registers to be a deceased donor, which means to be a donor after you die, we're going to give people the opportunity to learn more about living donation, ultimately end up getting a kit in the mail where we can get a saliva sample to find out your blood type and their HLA type, to offer the opportunity for people to check out living donation if it's right for them. It's not right for everybody, but to really sort of accelerate how many people that we are saving through living donation, which is really the only opportunity we have to save the more than 70,000 people that are currently waiting for a kidney transplant in the United States. Huge thank you to Fresenius Medical Care Foundation. UNOS is another one of our partners in this. LifeLogics is our IT partner, and CareDx for really working with us along with the National Kidney Foundation on really some groundbreaking work in the living donation arena. Next slide. All right, so finally, I get to stop talking and I get to hand it off to Bobby Howard. And I'm just gonna introduce Bobby by saying he's a big deal in our community. One of my favorite people in donation and transplantation. Bobby will tell you about his story, but I'll say he was a much better college football player than I was, and which is evidenced by the fact that he played for a couple of NFL football teams. So thank you, Bobby, for joining us. I'm gonna hand it over to you.
Thanks, David, and good evening, everyone. I am so excited. I don't get this opportunity to speak to colleges that are outside the state of Georgia. So thank you guys for having me this evening. I think this is wonderful that you guys are putting this on because it's some great information. As David stated, it's a wonderful relationship. I've known David 20 plus years now. We work together to do some amazing things, but I'm really, really excited because August is National Minority Donor Awareness Month. And we're celebrating the 25th anniversary of that month. I am myself a 26-year kidney recipient. Actually, next month will make 27 years that I've had my kidney transplant. And it's truly been a wonderful journey. And I think that, anytime you go through some things in life is that it's a plan. Sometimes we have plans for ourselves, and the good Lord above changes those plans, and he tells us what he wants us to do. And I think this is what I was placed on this earth to do. And I am so excited to be able to touch and help people understand the value of life. We live each day, but it's also, we have a responsibility, and that responsibility is to take care of our fellow brothers and sisters, regardless of where you come from and what you look like and all those things. So let's get to the presentation. National Minority Donor Awareness Month. Next slide, please. Why is National Minority Donor Month important? When you look at donation and transplantation, as David was giving this presentation, there's always an aspect when you look at the minority communities. So when you look at the minority communities, especially the African-American community, it's disproportionately high rates of diabetes, high blood pressure, and heart disease contributes to organ failure throughout the African-American community, especially kidney failure, which is a very daunting task that we in this industry that we always have to deal with. The number of people who are placed on waiting lists on dialysis and just having dialysis treatments. African Americans are 3 times more likely than white Americans to suffer kidney failure. And we look at our Hispanic brothers and sisters as well, they're 1.5 times more likely than non-Hispanics to have kidney failure. And those are some of the things that we really try to work with, not only with National Minority Donor Awareness Month, but it's a year-round thing. We just celebrate this month because we wanted something special to really raise the awareness and bring a special focus on this month. Next slide. When you look at transplants, on average, African Americans, Black transplant candidates, they wait longer than non-Black transplant candidates. Being here in Atlanta, Georgia, I look at our waiting list, and the average wait for an African American just here in Atlanta is 8 to 10 years for a kidney alone, and that's average. So you can awesome see that across the country, this is a dire need, and it's why it's so important that the African American and minority communities really get involved with organ and tissue donation. As healthcare disparities, are part of the need for National Minority Donor Awareness Month. That's why we have it. It's really much to bring outreach and bring communities closer to have a clear understanding, not only about the need for organ transplant, but we talk about health issues as well, and the overall life and diet and all those things that pertains to the health of minority communities. When you look at the gap in the transplant rates and waiting times in the African American population, those lower rates are due most of the time because of lack of awareness. People just don't know. People just don't know how important that you can be by just going to your DMV and registering to become an organ and tissue donor. Next slide. Our National Organ and Tissue Donation Multicultural Action Group, when we look back at this, our group has been in existence a little over 2.5 years, but this was something that was started. We felt that with this month being recognized, that we needed to come together as a group. We all had all these different organizations doing their own different things. So we wanted to do something different. We wanted to pull all groups dealing with donation together And it was formed in 2019, a collective approach. You know, our overall mission is to save and improve the quality of life in diverse multicultural communities by creating positive culture of donation through national observances. And our 3 goals that we came up with: increase transplantation through organ, eye, and tissue donation, increase the number of living organ donations, and reduce the rate and need for transplantation through disease prevention and education. And that's where the healthy diet and the healthy living and where that comes in to play a big role in taking your loved one to the doctor. Next slide. Our group consists of AMAT, which stands for Association for Multicultural Affairs and Transplantation, AOPO, Association for Organ Procurement Organizations, AATB, Association for, American Association of Tissue Banks, Donate Life America, which David is the CEO, DLA, EBAA, iBank Association of America, HRSA, Health Resources of America, MOTAP, Minority Organ Tissue Transplant Education Program, and NKF, National Kidney Foundation. We're also working with an organization called NELDAC. NELDAC is an organization that helps financially when it comes to living donation. So we brought them on board. So all these organizations, for the first time, you have all these organizations saying the same message. If you notice on some of the things, you can see one voice, one vision. That's our slogan: one voice, one vision, to heal and save lives. And our focus on the national observers is to reach these 4 communities: the African American community, Asia Pacific Islanders, Latinx, and Native Americans. Now, I think as we continue to grow, more communities will come into the fold. As America grows as a melting pot, we will probably try to expand on this list. But this group is charged with this month, and not only this month, but all throughout the year, to come up with creative ways to educate these communities. Next slide. Dr. Clive Callender, who is one of my favorite people and who's been around for a long time. He is the founding father of National Minority Donor Awareness Month. 25 years ago, it started out as one day. Then eventually, Dr. Callender is a stubborn guy, and he thought this was perfect just to have it one day. We did a survey and we asked around, if this observance was more than one day, would you be involved? And we did a survey and everything came back positive, so we changed it to a week. It was a week for so many years. And then about 2 years ago, when this group formed, the National Multicultural Action Group formed, we changed it to a month, which we're getting rave reviews. There's lots of education going on throughout the United States. There's different things with social media. And, you know, the unfortunate side, we've been doing it 2 years and we've been in COVID. So we really haven't put this to test going out into the communities to see what really is going on. But we've done some wonderful things. And one of the wonderful things that we do have that I was asked to mention is that we have a wonderful recipe contest. And if someone can put it in the chat where they can get involved with the recipe contest. But what we wanted to do, when we talk about healthy living, we all have to talk about diet and exercise. So we wanted to be really creative, that we created what we call a recipe contest. And in that recipe contest, we're inviting all those who think they're really good cooks and they got these great recipes. They have to be healthy. They have to be healthy. And we want you to submit those. And when you submit those, we have experts who are going to grade it, judge to make sure it's a healthy recipe, but it has to be focused on the minority and multicultural communities. So that is important. We have really good prizes. Then if you are selected, we create a calendar to go along with your recipe. So each month as they turn the page, it's a new recipe. We're also giving people something different. I know, like myself, I eat chicken a lot. I get tired of eating chicken the same way. So when I look through these different recipes, I say, oh, let me try that. And it's healthy. And so, we just want to really honor Dr. Clive Callender, the founding father of National Minority Donor Awareness Month. And he's also started National MOTAP, a Minority Organ Tissue Transplant Education Program 25 years ago. And so you see, that's why it's so important as we do this great work that we do along with DLA, along with all the other organizations that I mentioned. We have to come together and to build a greater bond, because we're all out here for the same message, and it's to help heal and save lives. And that's what all of our missions should be. And that's why we had this call. And that's why I am so excited as a recipient myself, and as someone who has a family history of my loved ones waiting for kidney transplants and who've passed away because they didn't receive a kidney transplant. It's very important to me. This is more than a job to me. This is my life. This is what I do. And that's why I am so excited that this university has taken this evening and you guys have taken your time to be a part of this wonderful discussion. Next slide, please. And why is it important for people of every community to donate? You know, donation and transplantation, you know, my focus is primarily on the African-American community for those reasons that I stated earlier, but all communities need to be involved. It's just not, you know, one race. It's just unfair that the African-American and the minority community suffer at a higher rate than other communities suffer. So that's why we have this big push, but it's not only about this community, it's about all communities that we're trying to serve. And, you know, when you look at, you know, the communities that we've mentioned make up 60% of individuals on the national organ of transplant waiting list come from the minority communities. And these communities are in great need of more organs and tissue donors. So that's why it's vitally important that when we go to register, when we hear and we sit on these kind of things, we have to take a deep look at ourselves and say, when my life is over, can I leave something behind that will give someone else life itself? Next slide. Now, that is all I have. Once again, I am so thankful for this opportunity. Thank you, David. Thank you, Hillary, and especially big thank you to James Madison University for this wonderful opportunity to speak. Now I will turn this over to Alicia Henderson from UNOS.
Thank you so much. Can you guys hear me? I just want to make sure.
Yes, we can hear you.
Okay, just want to make sure. Well, hi everyone. They're hard to go after. Everyone's presentations were amazing. So again, my name is Alicia Henderson, and I am a behavioral research scientist in the research department at UNOS. Just for a little background on UNOS, the United Network for Organ Sharing is a nonprofit scientific and educational organization that administers the only organ procurement and transplantation network in the United States, also called the OPTN, and the OPTN is the transplant system in the US. I'm super excited to be here today to talk to you guys about my involvement in the Equity and Access to Transplant dashboard, along with my other colleagues at UNOS. So next slide, please. Thank you. So the OPTN has several strategic goals, with one being increasing the number of transplants, providing equity and access to transplant, promoting living donor and transplant recipient safety, and improving waitlisted patient, living donor, and transplant recipient outcomes. Next slide, please. So the Equity and Access to Transplant dashboard really was a product of the second strategic goal here, which was to provide equity and access to transplant. Next slide, please. So before we can talk about the Equity and Access to Transplant dashboard, we have to talk about what is health equity. So health equity really is the ability for everyone to have a fair and just opportunity to be as healthy as possible, no matter their social position. Next slide, please. So many factors contribute to a person's ability to be well and to live their healthiest lives. This includes, but is not limited to, these determinants of health that I'm going to list. So where a person lives, their ability to get and secure gainful employment, their access to healthy foods in their communities, how safe they feel to exercise in their communities, their access to health insurance, as well as their experiences with both personally mediated and structural racism in their lifetime, as well as many other determinants can kind of play a role in whether or not someone is able to live their healthiest life. Next slide, please. So the OPTN committee volunteers really do work to increase equity and access to transplant by developing data-driven, patient-centric organ allocation policies that go through a transparent public comment process. Next slide, please. So we know what equity means. We know that the OPTN has these different strategic goals that kind of birthed the Equity and Access to Transplant dashboard, but how do we quantify equity and access to transplant? Next slide, please. So I showed this lovely diagram to demonstrate that a lot of different things factor into how long a person waits on the waiting list for a transplant. And some of this is really due to design. There are other things that impact access to transplant that we really don't want to access it or impact the access to it. So for example, the system gives a lot of priority to people who've been on dialysis for a while, so their time on dialysis, which we want, but we don't want people to be treated differently, let's just say because of their blood type. So in essence, we would really like candidates to have equitable access to transplant. Next slide. So our overarching research question was, after accounting for certain factors that we account for on purpose in organ allocation policies, such as like kind of time on dialysis, MELD, heart status, LAS, how is access to transplant impacted by some of these other kind of social and socio-demographic factors, such as race and ethnicity, education, blood type, which is more of a biological factor. And so, next slide, please. So we use the National Institute on Minority Health and Health Disparities Framework as a way to understand the ways in which different factors can influence a person's access to transplant by looking at the potential of levels of influence that you see across the top and the domains of influence and how these things kind of work together to create the health disparities that we see today. So most of the current health research really focuses on that individual level, despite the impacts and important aspects of community and societal level factors on the creation of health disparities. What I would say is a huge strength of the existing equity and access to transplant dashboard is that it really focuses not only on this individual factor or individual level, but also on the community level. And I'll go into that next. Next slide, please. So as of right now, we are looking at individual level factors such as blood type, whether or not they were prior transplant recipient, their age, insurance type, race and ethnicity. These are some individual level factors that kind of factor into our equity and access to transplant dashboard at the moment. Next slide, please. But as far as community level factors, we're trying to see whether or not if someone lives in an urban or rural environment, how is that impacting their access to transplant? So along with other environmental factors. Next slide, please. So we have, the dashboard uses the OPTN's access to transplant score to really explore how different factors impact how long waitlist candidates have to wait to receive a deceased donor transplant. So those different factors that I just went through, those are kind of entered into this statistical analysis to see how they're associated with deceased donor transplant rates, and you'll get one single score, and that'll be your access to transplant score. Next slide, please. So the amount of variation in these scores among waiting list candidates reflects the degree to which the respective organ allocation system is equitable. So as you can see with the initial, distribution, it's a little bit wider. So there's a lot more spread of these access to transplant scores, which we don't want. We want it to be this improved equity that we see now, where these access to transplant scores don't vary as much and the spread is not so wide. Next slide, please. So this is the part that people have been waiting for, is the equity dashboard. So next slide, please. So the equity dashboard, like I said, it really looks at the access for candidates after listing. So we don't, so the equity and access to transplant dashboard does not look at folks before they are on the waiting list, but after they're on the list, and it's updated quarterly. So it really tells you what factors are most associated with disparities in access to transplant. So those factors I was talking about from the framework, and how has access based on an individual factor changed over time? Next slide, please. So in an effort to ensure that content and findings of this dashboard could be accessible to both patients, transplant stakeholders, and their families, I was really brought in to create this landing page that really explains all the things I talked about today. So what is health equity? What are the OPT and strategic goals? What is the NIMHD framework? And try to make it try to also make the access to transplant score more digestible, because even myself, I'm not a statistician. So sometimes I don't know what it always, what these statistical methods are always saying when it's, in a from the mouth of a statistician. So I even myself have to break it down. And so that's really what I kind of came in to do. And so this dashboard at the moment also currently has organ-specific trends for kidney, liver, lung, and heart. Next slide, please. So like most things at UNOS and most wonderful projects that we get to do, it really is a collaborative effort of many people who are bringing their special talents to make our project beautiful. And so this one here was a collaborative effort between the research and the communications team. And it was a true pleasure for me to be a part of it. And we were able to create something wonderful. Next slide, please. So I just wanted to really show you guys an example of what one of the dashboards look like. I will be sure to put in the chat the website that was at the top that you can kind of go, as publicly accessible, and look at, if you're interested in heart or if you're interested in liver or kidney, you can look and see what these dashboards look like, and they're really interactive, and you can press on any of those factors that I've talked about from the NIMHG framework, and you can see how it is varied over time. And so this one was for the lung equity dashboard. Next slide, please. Thank you guys so much. And I'm looking forward to any questions you guys may have. Thank you.
Well, thank you for the presentation. Anyone have any questions? I have a few. Does anybody else have any questions before I ask? Thanks, Carrie. You guys can unmute if you want to ask a question. But I do have I have a few. So I think, David, you mentioned in one of your presentations about at risk. And I was wondering, how do you find out if you're at risk? Or what is the test for at risk? You're on.
Sorry, I'm muted. I'll let Bobby jump in on this too, but one of the things we want to encourage people to do, particularly in the African-American community, is to get checked out and see if you're at risk for kidney disease. Freeway is a great example. Freeway had no idea that he was at risk, even though he had a tremendous number of members of his family that had hypertension, and he just never really connected the dots. He's like, had I known, I would have gotten checked out way earlier. It was just something that, he never really thought about. I know Bobby and I know a gentleman, his name's John Brockington, who was a All-American football player at Ohio State University, broke the rookie rushing record in the NFL at the Green Bay Packers, who Bobby played for. And he had no idea he was suffering from kidney disease. He was one of the top players in the NFL, and he just started getting tired and weak and ended up ruining his career, but he had no idea he was in kidney failure. And when he finally found out that he needed a transplant, he'd been in kidney failure for years and had no idea because he just wasn't going to the doctor and getting checked out. So I think the initial answer is, go to the doctor often, get checked out. And Bobby, I'll let you jump in here on that, because I know this is something you really work with the NFL Players Association and all the guys that you know.
Yeah, I think David hit it right at the nail on the head. It's vitally important. One of the things that we're doing differently is that we're reaching out to the wives and significant others of men, because we all know a lot of men will not go to the doctor because of fears of other things that may happen. So we're doing a lot of things with reaching out to the significant others to have them take their loved ones to the doctor and making sure they get those checkups. Almost in my situation, my mother received a kidney transplant in 1976. She didn't live too much longer after that, about a year after that. But, with my football and playing, I never knew that I was predisposed as hypertensive, until my football career was over and I wasn't as active as I was, and my kidneys failed. And, we have those things. And even I was getting annual physicals that were not the normal physicals, but just things. And sometimes it happens, but if you can prevent it and start doing things at an earlier stage, the list won't be as high. So that's really important to, to be to get your checkups and following instructions that you're given by your healthcare professional.
Which follows up to the question when you mentioned 3 times more likely to suffer for kidney failure in the African American community. We're at high risk for basically everything. So I'm just curious as to why that is.
Well, I think, if you really go back into our lineage and history, a lot of it is caused by diet. And, when you go back to your lineage and of how African Americans and that we were eating and what we ate way back before we were even thought of, in those traditions, with a high diet of fat, high salt and all those things, and over years and centuries, and when that persisted within the community of our eating habits, our lack of exercise, all those things become hereditary and are passed down from generation to generation to generation. Now, not saying that that's the root of all the causes, because all those things can be prevented. They can be prevented by changing your diet, exercising, following your healthcare professionals' instructions, and not ignoring the signs that are out there. I'll use this for me as being a man, talking to a lot of my friends and getting things done about going to the doctor. We won't take certain pills because we think it affects our sex drive. And so we won't take those pills, and we'll just suffer the consequences later because we feel that's more important at that time in our life. So there's a lot of education that needs to go out there, and that's what we try to do, not only with the donation piece, but we want people to be healthier, and we know those are some of the causes out there. So we really preach the healthy diet, exercising, and then we'll worry about the other factors later. But we need you to be healthy because we don't need this list to keep growing.
Yeah, because there's so much, particularly in the diabetes world and the hypertension world, that can be dealt with diet. A lot of it's where you grew up, how did your grandma teach you how to cook? I grew up in the South Carolina, and I grew up eating fatback and biscuits, and my grandmother was told she was diabetic when she was 22 years old, and she ended up with both her legs amputated because she didn't want to give up her biscuits and her molasses. So it's the goal of educating people to recognize that these short-term, my father always talked about being short-sighted and long-sighted. When you're a kid, you're Superman. Like Bobby was like me. We were playing football. Nothing was going to hurt us, but being long-sighted and recognizing that the decisions we're making, being, as Bobby said, I have got a lot of friends that don't want to take blood pressure medicine because they're concerned about what that's going to mean for them in the bedroom, right? So it's having the opportunity to think a little bit more alongside, and hopefully helping people through stories like Bobby and Freeway and men of substance that have been successful, sharing their stories and being vulnerable to share their stories is really important to help people understand the opportunities that they have to prevent needing a kidney transplant and dealing with it when you're 25 or 30, and don't wait till you're 55.
Does anybody, I don't want to keep talking. Does anybody else have any questions? Bettina, Katrina, Valerie?
And by the way, I'm definitely blaming my blood pressure medicine on my performance in the bedroom. So,
David, I was a pharmaceutical representative for Astra, and let me just say that I sold Toprol XL, which is a blood pressure medicine. So those are the battles I had to fight with the doctor. And there was a question I always asked, like, was I before or after the problem? Just saying. Please, doctor, prescribe.
That's a good one there, Miss Paula.
So the other question I may have is battling with everything that's going on, and we're in today's world with African American culture. How are you getting past, or what type of documentation do you have to help battle the fear that African Americans have with just the whole healthcare industry? how do you handle that?
Well, that's a very good question. And I think when you're talking about building up communities, it starts with trust and honesty. And when you're going in the community, you have to share the truth in that there are things that are out there that everything is not always great. But as those things are not always great, it's really important that you take control of your life and your health care and your health. So you have to empower those who have these fears. So I believe that once you empower those and you tell them the truth in that, and when they ask questions, don't be afraid to answer, because there is some truth, and I can't take away someone's reality of what they believe to be true and to be their fact. I can just provide them with the correct information. I can be truthful with them, and they have to make that decision on their own. And that's all I can do. But I will say this, I'm here in Georgia, and the organization I work for is LifeLink of Georgia. With all the things we have going on with the pandemic, we had another record year with the number of African-American organ donors that we've ever done here in the state. And those numbers just keep growing and growing and growing. And I've been doing this job almost 27 years now. And I just preach and believe that we have to be a part of the solution and not the problem. And understanding that organ donation and transplantation may not be the topic for that organization on Friday. And I have to meet the community where they are. So it may be a situation where organ donation is not their need on a Monday. It may be they need coach for their children. So it's really important for me to build those other relationships in the community, to bring folks who have those coats, and to bring folks who have the things that community needs. I will get my message across, but I have to meet the community where they are. And I think that's the job that we're starting to do around the country with our minority communities, is starting to see that we can't just go in talking about donation and your health. We have to just meet communities where they are.
That's awesome. And my last question is, how does someone get involved in the multicultural part of the outreach? How does someone get involved in that?
Sure, it's very easy. I think with Donate Life America, since I am partnering with them on this, and we don't have anything specific to the National Multicultural Action Group, where we don't have a website or an email or anything like that. But I think if you can reach out to Jocelyn Reed at Donate Life America, and then we can always provide information to James Madison, to all parts of the country, and provide you with the things that you need. We can talk with you. We can sit on these kind of things. We could train you to be the one to be the spokesperson for your campus or your school or your office, all those things. But we really want folks to get involved, because I'm a firm believer, when we talk about organ donation, I believe in you have to have same race or same ethnic background educators. That's very important, that to me. And when you have that, now I can tell stories that are meaningful and that someone can relate to. Like David said, the fatback. I would have never known that David grew up eating fatback. I didn't even grow up eating fatback. So those kind of things that people, you need to hear those where you can relate. If you can't relate, the message goes nowhere. So those are the type of things. And so that I'm very intrigued that you did ask that question. How can you get involved? And it's very easy. We need more soldiers on the ground to really help put this message out there.
I've exhausted most of my questions. Katrina or Bettina, did you need any, or did you have any questions that you may want to ask? Don't be shy.
I was going to say, one of the things we can offer, and I'll talk to Hillary about it, is we can create a campaign page for you guys where you can measure how many people are registering as a result of your outreach. I know certainly I'm available since I've got a student there. I know Bobby's available all the time. But I think importantly, to Bobby's point, is finding those champions within JMU. Matching the messenger to the people that we're trying to reach, I think, is vitally important. Would love to find some athletes. I guarantee you at JMU, you've got a lot of athletes that have friends and family members that have received transplants or are waiting for transplants, to have them be voices out to the community. We're in dire need of getting young men 18 to 35. That's our, you women are very generous. You guys are great. We look at our numbers and it's us guys that lag behind. And finding those incredible spokespeople that are icons in their community, is just, you can't put a price on that conversation. And then, and one of the things Bobby said is trying to meet communities where they are. We don't want to just be asking people to give all the time. We want to give back. And that's why we're trying to educate people about healthy living with the contest that we have for the recipes. It's helping people understand that, as Bobby said, no one should care about your healthcare more than you do. And putting the power in the hands of people. I've experienced that with my family members that have had cancer and have been struggling with it. And nobody cares as much about your healthcare as you do and your family. So really putting that power in the hands of people. And to your point, I think, which is a really vital one, which is trying to break down the barriers and because of a lot of legitimate reasons, there's a lot of resistance to healthcare, and there's a lot of skepticism there, and trying to break those barriers down and getting people comfortable with, trusting your physicians. I know Amber, I'm sure some of her best friends now are some of the physicians that she met along her journey, and helping people understand that we can trust them, and really being willing to be vulnerable and to have those conversations.
We'll definitely be in touch. I can definitely help navigate some of that on campus. I guess the next step I would think is talking to the Alumni Association overall, because we have some other affinity chapters, especially the Latinx chapter, that could possibly get involved too. So we can take that to the next level as well.
So I do have a question.
Go ahead, Katrina.
Okay, so I have indicated on my driver's license through DMV that I want to be an organ donor, but should I do something else? Do I need to go somewhere to still register, or is that sufficient at this time?
No, I mean, you're good. If you want to register on our national registry, you can do that. You can go to registerme.org. The one challenge we have with some of our states is that when your driver's license expires, so if you moved to North Carolina and your driver's license expires in Virginia, sometimes that decision doesn't carry over. So we always encourage people to register on our national registry at registerme.org, or you can do it on your iPhone through your health app. But if you registered through DMV, you're pretty good, especially in Virginia. They do a good job.
They do, and both the local state registries and the national registry are checked by donation professionals.
Which begs the question. So you mentioned in your early presentation, David, about the families being, of course, when something happens and distraught, and you're an organ donor. So even if they try to change it, it's still the fact that our wishes are respected and carried out. Correct?
Yes, that is correct. We call it first person consent, but it's your legal decision. It's a legally binding document that you want to be an organ donor. And one of the things that we've championed, that I know Bobby's organ recovery organizations have been a huge champion for this as well. It's your decision, and we don't want to allow, in a moment of grief or concern, for a family to be able to override your decision. Organ and tissue donation is based in gift law, which is the same law that governs how you give away your possessions when you die. So you have a will, and you decide that you want your chest of drawers or your clothes or whoever to go to Aunt Henry, Aunt May and Uncle Henry. So we honor that wish to be an organ and tissue donor in the same manner. It's your legal decision to be an organ and tissue donor. We're going to honor that over and above your family.
Awesome.
And I think it's also to add that what we strongly suggest is, once you make that decision, you share that with your family, friends, everyone, because that makes that conversation when you do, or when your life is over with your family, surviving family member, that makes that conversation a lot easier when your family members know what your decision was.
Yeah, and Bobby said, hundreds of conversations. It's a real gift to your family to know what you want, and to not leave that decision to them at a time of stress to make that decision. I know when my mother and father died, I didn't want to decide what suit my father was going to wear in his coffin or what dress my mom was going to wear, much less whether or not they wanted to be an organ donor. So it's just a true gift to your family to let them know what you want to do, so they don't, in a world of 1,000 decisions that have to be made, it makes it easy on the family, and it's a real gift to them to know what you want. And I completely agree with Bobby. our original message at Donating Life America was share your life, share your decision, which is register to be an organ donor and share that decision with your family to make sure they know what you want.
I just wanted to add, I don't know that we've talked about it yet, but I don't know that many people know that there is a family support team as part of recovery agencies. So there is someone there to support your family in the hospital. And I think that also is a point of comfort in the process, that there is someone there to help guide them through.
Yeah, one of the great things about being a registered organ donor is it allows the organ recovery organization like the one Bobby works for to be able to help your family heal and to deal with the loss of a loved one. And that can become their focus versus trying to get a decision as to whether or not you're going to be an organ donor. So they can immediately begin helping your family heal and deal with the loss of a loved one versus trying to get to yes, if you will.
That's good to know. That's good to know.
Yeah.
Anybody else? Well, if we don't have any other questions, I think we can sum this up. I want to say thank you to everyone. I am inspired, and so I would say that you can put me down as a spokesperson, whatever you need me to do. So get me trained. I'm a believer. I just ask. My only belief is that please don't cut me up too bad if something happens. That's my only ask.
Well, and I will say, I meant to say it earlier. When I got hired, the very first thing that happened is the gentleman that hired me took me to see an organ recovery. And I was blown away with the care and tenderness that organ recovery organizations deal with organ donors. This woman was 72 years old. She'd been a nurse at a hospital. She had had a heart attack, was an organ donor. And the organ recovery coordinator put makeup on her. So when her family saw her, she wouldn't look so sort of drab, and just put a blanket on her so she would feel warm when her family touched her. Just the incredible care and tenderness that our organ recovery organizations treat donors with true honor is really exceptional and unbelievable. So I can't stress enough how much this gift is not only honored by the patients like Amber that get an incredible gift of life, but the respect and the care and the generosity that is recognized by the community is really exceptional. And I've never seen anything other than that standard portrayed in our community.
Well, that is a good to know and good relief.
I will say, Paula, that is one of the, when you're out in the community, that is one of the biggest concerns that a lot of people have is how do you remove all these organs with one incision, and how is that process done? So being able to explain that and giving that family or that person before they go to the DMV or register on site, that comfort that nothing's not, it's not going to be done in a way that your body will not be recognizable, but you're treated in the utmost respect. As David stated, there's a lot of requested families have in our organizations, just like all the other 56 outside of the LifeLink, the one I work for. We take pride in that because it's not about us, it's about the donor and the family.
Yeah.
So anyone else? And after this, I'm going to close it out. I appreciate. Any other questions, Katrina or Bettina? Anyone else?
I have one other thing. I just have one other thing to say. I just wanted to thank Amber for sharing her story. You were very young and going through what you've gone through, and then what you've accomplished after you received your transplant is phenomenal. And I just wanted to encourage you to keep up the good work, stay strong, and things will be okay. And because what you're doing, you are honoring the family that gave you life by the work that you're doing. So thank you.
Thank you.
That's awesome. Thank you.
So we can end with a JMU Dukes.
We can do that. I want to say thank you to everyone first. I want to thank you guys for taking the time to just give us this information. I feel so much better. And, even though some of us missed this live, it's recorded. So I'm hoping that whoever sees this will be encouraged and inspired as well by the stories and by the information that's out there, and to, educate yourself on just becoming a donor. So thank you so much for taking the time. And on that note, David, you want to lead us off?
JMU. Dukes. All right.
Thank you so much, everyone. I appreciate it. Have a good
Thank
night.
you so much,
Paula.
everyone. Have a great night.
Thank you.
Thank you, guys.